The world is fighting an unprecedented health crisis, and we're all trying to adapt to the new normal. Well, on this episode of Community Forum, we're going to be taking a look at how it has changed our community as journalists, especially in TVC News. And we're going to be looking at how the COVID-19 pandemic is changing our lifestyle. During the time of crisis, such as the current coronavirus pandemic, it is even more important that the public have access to reliable and timely information, and journalists have a key role to play. The global scale of the COVID-19 pandemic has forced countries around the world to take serious measures, including closing borders and imposing quarantines. This has increased multidimensional challenges to the journalists who are reporting on this story from across the world. From the impact on human life to overwhelming medical systems to how this pandemic is challenging countries and the spate of other deadly diseases, journalists are on the front line, giving you the news. So this is the story of our community, the TVC News community, which we hold dear. It is a melting point of diverse cultures, a fabric of different patterns. Though apart, we are one because of technology.
Mile 12 International Food Market is...
From those on the field to producers and editors in the newsroom, to the anchors, to those in the different bureaus, every single person is at risk, but we must continue to keep you informed. The COVID-19 pandemic is changing the way journalists do their duties. Journalists across the globe face a lot to report the coronavirus pandemic accurately and safely. There are health and security risks, and you must uphold ethics, professionalism, and social responsibility.
The COVID-19 pandemic has come with a new culture, a new system, and a very big challenge for the camera person. For the TV station, really, the camera person is always at the forefront of getting that, shot that the reporter, producer, or whoever would love to use for his news or program. So for us, really, as camera persons, it's more like war. You go, as we're going out every day, you must prepare yourself. All of us have our sanitizer. We have to wash our hands. We are coming back. We are washing our hands. A whole lot of change in the way we do our things. You are very careful who to touch, who not to touch, because before we used to change, like, oh, hold this microphone for me for an interview, but now we don't do that anymore. It has to be your reporter. If your reporter is not close by, you hold it yourself, because your reporter is a person you leave the station with. You are well prepared together, you know yourselves, you go to the event and then you cover. It's been challenging, really.
Reporting on COVID-19 means you have to be safe, and many have been taking precautions as this is an uncharted territory. They're also at risk of contracting the virus as much as health workers. Let's start from the headquarters located in Lagos, the epicenter of the pandemic in Nigeria. Since the 27th of February 2020, when the index case was reported, a lot of things changed in our community. The coronavirus pandemic coverage became a priority.
Since the news broke on 27th of February 2020. My first time at the Yaba Isolation Center was on 29th of February when the index case was at the facility. So, and another experience I would say I was so close to it was when we visited the Yaba Isolation Center for our special report. Many people don't believe that this thing exists, and then we just need to let them know. When we got there, I knew that the place was filled to the brim with COVID-19 patients, and then immediately I got in, Prof just said, "You are here, you really mean business." He told me and my cameraman that our health is actually at risk for stepping into the biosecurity facility of the Yaba Infectious Disease Hospital. But because of the scarcity of PPE, personal protective equipment, was so scarce, we couldn't find anyone, and the ones that are available with the Lagos State government are just meant for the healthcare workers, and they cannot really give out of that, and we reasoned with that. Initially, when the news broke, I was actually avoiding the Commissioner for Health, for instance. I was avoiding the governor. I didn't want any contacts with them because I knew they are at the front line. The level of front line differs, They are the Commissioner for Health 100%. So I didn't want anything I don't want to have anything to do with him. But when it was time to do a special, then I just had to put all that behind me, and the focus was how to get the story. I had to tell my boss that I needed a break, and that was why I wasn't on Inside Lagos and I wasn't at the State House. My colleagues, stood in for me at that time, because I got to a stage that I really want to, check myself if I am actually not positive to the virus, and those were the real challenging period for us as a journalist being on the front line.
In the early days of the pandemic, Kano was one state that recorded the spike in mysterious deaths. Many had projected an explosion of the virus, and reporting from here means one has to be on top of his game. Correspondent Ibrahim Issa tells us his experience reporting.
Well, covering COVID-19 is a bit Herculean. It has been a very difficult task because you are going to the field to cover a story that you don't know whether those you are going to meet have contracted the virus. So it was a bit difficult. You have to abide by the protocols laid down by health professionals by covering your face with a face mask and using hand gloves, and as well doing all other protocols of social distancing. As a journalist, you've gone to the field and you want to make interviews. We had to use different gadgets like the poles that we connect to our mics to create a lacuna, a gap between you and those you are interviewing. So it has been covering the story, telling the story with something new. Those activities made the job even more difficult. You go to the field, you mingle with the people, then you come back to your family thinking whether you have contracted the virus, gathering the fact that you have fear when you go out. Then the coverage of COVID-19 has introduced so many modes to the job entirely. You have to maintain social distancing, you have to wear a face mask, wearing the face mask with difficulty, and then wash your hands regularly. Your equipment also needs to always be disinfected. So covering COVID-19 generally is something that we have been doing. It is actually a very difficult thing covering COVID-19. Recently I was in the isolation center to report on what is actually going on at the isolation center, and it was really a very scary moment for me and my cameraman. We had to use the personal protective equipment, and that was when we come to realize that even those medical personnel using those PPEs are actually doing well. It was actually something that one can never imagine how difficult it is to breathe with the goggles on you, with the face masks on you. Some double the face mask. The hand glove is double. You have your clothes on and you have the PPE on you. You go into a hall, you breathe difficultly. You ask questions looking at those who are already positive, who are on ventilators, who are currently at the intensive care unit. It was actually a very difficult thing. It was scary, but you have to go extra mile as a frontliner to report to the people. This is actually what is happening. It was actually challenging. Sometimes when you go in search for information from authorities, some think that you are those ones that are actually spreading fake news. So at some point we had that challenge. Even though we have no option, we can't stay at home, but we have to stay safe. We have to go out to find whatever that the people are expecting, and then we put the story to them to show them this is exactly what is happening.
Still battling an insurgency that has rocked parts of the northeast for more than a decade, Borno State is the worst hit. A large number of displaced persons and camps are in the state, and physical and social distancing remain a challenge. Grappling with the incessant attacks by Boko Haram insurgents, working as a journalist here in the midst of the coronavirus pandemic can be tough.
Working as a journalist, especially in the midst of the coronavirus pandemic, is really taxing. While other people stay at home to ensure that they keep safe, they protect themselves from the virus, I go out every day to ensure that I keep them abreast with series of happenings around them, especially the coronavirus pandemic. After the news of the index case in Borno State, people have been thrown into a panic mood. Everyone was afraid. I was also afraid because I'm like any other person. How I protect myself when I go out for coverage is I make sure I wear my face mask, I use hand sanitizers, and use my hand gloves, I make sure that I don't keep my microphone on the ground. And some of the challenges I face was sourcing news. We get news from NCDC officials and government officials, and during the pandemic they are indisposed, and you have to keep people abreast. You have to keep people up to speed on the coronavirus pandemic, and sometimes you call the government officials, they don't pick your calls, and people want to know what is happening. All our reportage was focused on the coronavirus pandemic. You know, Maiduguri has its own peculiarities. We have influx of people in the state capital, talking about the IDPs occasioned by Boko Haram insurgents. In the IDP camp, there is no room for physical distancing, considering how people live. They live in cluster. In a tent, you find 3 to 4 families, and in an IDP camp, you find more than 50,000 IDPs living in a camp. So observing physical distancing was a problem in the state.
Port Harcourt, the real estate capital, brimming with people and cars on the road as the pandemic rages on. How does reporting from Port Harcourt feel at this critical time of combating misinformation, providing public health updates, and providing information to help deal with the virus impact?
Doing the job in Port Harcourt certainly hasn't been business as usual because of what's happening in the world right now, the coronavirus pandemic. On a daily basis, I remain very concerned for my safety and that of my camera person. I make that emphasis because persons like to think that we journalists are superhuman, sort of. We have some form of superpowers. We are immune to the kind of things that affect society, forgetting that as journalists we are human beings and we are in society, so the things that affect society equally affect us in equal measure. So yeah, we go about our daily jobs with that concern that we face a clear and present danger of being infected by the virus. Why? Because we are heavily exposed. We meet a lot of people, random persons on the street, especially when we have to seek their opinions on issues happening in the society and issues that affect them. Also, we are very much exposed to medical facilities that are in the forefront of the fight against coronavirus. We've had to visit the University of Port Harcourt Teaching Hospital that has a treatment and testing center and as well as an isolation center. We've also had to visit, in the course of the job, the Rivers State University Teaching Hospital, which also has a similar facility. Of course, in same vein, we've had to visit an interview and interact with medical professionals and medical personnel who have one thing or the other to do with the fight against coronavirus. So we have been very, very exposed in the course of doing the job. So that gives us a whole lot of concern.
Interacting with so many contacts daily is a must. And there comes with the issue of harassment, stigma and discrimination. Stress, anxiety are indeed real consequences of fighting and reporting this pandemic.
Anybody that tells you that he faces danger and is not afraid is probably lying or probably has a serious medical condition. The truth is this: you get scared. And you know, courage, like they say, is not the absence of fear. It's the ability to manage that fear, to rise above the fear. So, of course, I get afraid, and I'm sure a lot of my colleagues also get scared. But you know, regardless of that, you just know that you've taken a job and you have to do it. Like there was a report that I did with my team. We went to an isolation center where there was protest, and we found ourselves in the midst of people that were positive. We didn't know. We were just informed that there was a protest going on. We had to go there and cover it. While we were there in the midst of them, we found out that some of them were positive with COVID-19. So we had to deal with that. So naturally you get scared. Naturally you get worried. Sometimes you also feel like, is it worth it? Is the risk commensurate with the reward? After doing that story, we got a lot of feedback from people who commended us that we did a good job. But we also got a lot of backlash from influential people, government officials, a lot of acrimony, a lot of insults. So it's bittersweet. I almost put myself in self-isolation because I was worried that it's possible that I could have contracted disease. Despite the fact that we had face masks, we had sanitizers, we had all the protective gear we could have as civilians. We had almost all those things and we took all the precautions. But yes, we get scared, we get worried. But even after that case, aside from the COVID-19, that report, we've also gone to the under isolation center that was set up for transit, people in transit. We've had to deal with a whole lot of things. So the fear is real, the concerns are real. So we've had situations even when people have attacked us physically. People have threatened us, people have tried beating us up. So these are part of the job and we just have to learn to deal with it. But we also wish that the public knows what we go through to bring them this information. When they sit down in their houses or watch their TVs or listen to their radios or read newspapers, they have to also realize that there are some people out there that are putting their lives on the line, that are taking risk to get them this information.
Nothing in the world today is more important than our common fight against COVID-19. And that fight starts with spreading accurate and up-to-date information and insights. And when all this is over, we will all rise like a phoenix from the ashes, stronger, better, and more resilient for the future we hold dear. COVID-19 is real, it's not a hoax. So we ask you as a community, do follow all the safety precautions that are being given by the NCDC and the WHO. That wraps it up on this edition of Community Forum. Don't forget, you can watch this episode, previous or subsequent episodes on our YouTube channel. You can also get in touch with us and invite us to your communities on the social media platforms displayed on your screen. Many thanks for watching. I'm Sarah Yuku. I'll see you next time. Stay safe.